The meniscus is a very important part of your knee. It sits between the two bones and is a jelly-type cartilage that sits and basically provides shock absorption for your knee. And the biggest main function of the meniscus is to help prevent arthritis. There's two of them. There's one on the inside and one on the outside of your knee, so medial and lateral. I would say majority of patients and people hurt their medial meniscus, and really the way they do it, it's a twisting type injury. Sometimes what happens, the foot gets stuck, your body turns one way, and it causes your thigh bone and your shin bone to twist on itself, capturing that meniscus between the bones, causing a tear. And then you have the older patient that just has arthritis. Basically, by the time you're over 50 years old, you're starting to get wear and tear on your knees. In that process of wearing out, you'll get some tears and some damage to a meniscus for that purpose, but a lot of those don't need surgery. They can kind of heal on their own, or what we call asymptomatic, so they stop hurting. Therapy is huge. What happens with arthritis, you get swelling, you get stiffness, and your muscles shut down and all that. So doing therapy can help you a lot. It can make a huge difference. So I usually say, let's do some anti-inflammatories, do some ice. Occasionally we'll do a cortisone shot in your knee, and then we send you to therapy. And if you're not improving after about 6 to 8 weeks, then we'll talk about going in there and scoping it. But the younger patient, or if you do it acutely, as in you were walking, you were fine one day, you walked, you twisted, and all of a sudden you started having pain, that's an acute tear where it just happened. And those are the ones that usually you'll need some kind of treatment. Majority of the time that can mean surgery, where we go in there basically through little poke holes, arthroscopically go in there and look at that meniscus. Most patients, I'd say, it takes about 4 to 6 weeks to recover from a knee scope if all I'm doing is cleaning out the tear and just trimming it out. Now, if I have to do a repair, you're looking at crutches for 6 weeks and about 3 months before I let you start running and doing athletic type activities. I think one thing that's very important for people to understand is surgery is not benign. So there's always risks involved with surgery. And so it's real important to make sure, if I don't have to have surgery, maybe trying the conservative approach with therapy, and that's important because we live in a world where we want instant gratification, right? We want to be fixed right away. Well, surgery is not always a quick fix. It's real important to take all the factors into play and also decide for yourself if you want to go through a risk of a surgery, because I'm a surgeon, so I love to operate. But my job is to make sure we do the right thing for the patient.